you're saying that I'm gross? No, I'm just saying that you haven't had a cleaning in 3 years and, you know, you need a gross debridement. So that's the debridement you do on gross people? Well, not exactly. And I've seen so many people fall on that sword where a patient comes in and they want a cleaning and we fight them and we're saying, "You can't get a cleaning today. You can't get a prophy. You have
You
to
have
get
to have a gross debridement."
and then
Or
they write you a bad review because they wanted a cleaning, when a gross debridement is really just an insurance code
yes, sir.
for cleaning the teeth that you see. So to the patient, yes, their teeth are now clean, but there's a whole bunch of crap below the gum line that you didn't get to yet. But the patients are probably like, "Can we just do this all the time? I just want to look good. I just want to do that whitening you did." But obviously, we use verbiage, and some of it is benefited for insurance companies, some of it is benefited for our instructors in dental school, but usually it's not benefited for patients, and it drives a lot of upset.
The people that, Greg, in your life, think about all like the dental masters that you've known, right? Who are just masters at enrolling. One thing I think without fail you would say is that they have an excellent way of communicating with not only their team, but also patients. And they do not use words like this, right? You know, Ms. Jones, we're going to do a gross debridement and walk out of the room kind of thing.
Yeah.
I'm not saying it's part of the puzzle, in my opinion, for enrolling is to empathize with where the patient is. And they didn't have the benefit of 4 years of dental school to be on the same page with you as knowing what a radiograph is even. Right. I don't know what a radiograph is. Say x-ray, right? And so today we're going to talk about just some key things, words to use and words to possibly eliminate, or phrases to use in lieu of. And I posted this question on our Mighty Networks, which has got, you know, about 1,000 users now, Craig, up on
That's
the
awesome.
yeah, and people can join. It's a free place to join and post questions and just collaborate with like-minded dentists, you know, Bulletproof type dentists. Just go to bulletproof.dental if you haven't joined. But anyway, this question was posed is basically, I was just sitting there thinking, I don't know what popped in my head, but I posted this question and got a lot of good feedback from people kind of collaborating and saying this, you know, I got another suggestion of one to talk about. But I was basically, the title of it is basically just, and it did start with gross debridement, I think, to your point, Craig. But I'm going to go ahead and put it up on the screen. And if you're able to follow, if you're watching this on YouTube, good for you, because now you get to see it. If not, Greg and I will verbally kind of talk about this. So we talked about the gross debridement thing, which I think if I had $1 for every time I've ever heard that in dentistry, it'd be a fair amount of dollars. And you just cringe because you know the patient is not going to say anything more than likely.
Of course, yeah.
They'll probably maybe, you know, leave with a little butt hurt, maybe not enroll, and maybe give you a little bit of a bad review, but they're not going to say anything in there because they are already feeling intimidated.
Yeah, their feet are up, the light's in their face.
Yeah, they're leaned back, and you're probably talking to them like when they're fully reclined, and they're
doing isometric sit up, just like trying to listen to you. Literally, they're literally crunching. They're shaking because it's been like 5 minutes. They're like, "Can I lean back? I'll do whatever it is." But never mind the bad language and the way it sounds like they.
Wait. We need to put a pin in that one for a second, because that too. If I had $1 for every time you've seen that, look, anytime you have to talk to a patient, just hit the up button, even if it's for 5 seconds,
even
just to look them eye to eye, right? Yeah. When you're done, just look them eye to eye, knee to knee.
The overhead light or your headlight is in their eyes, and they're doing an isometric crunch, and you're trying to enroll them. So what do you think of the veneers? They can't even speak. The core is shaking.
No, and there's a Mirror and Explorer in their mouth, more than likely, right?
And no, the suction's there still. It's sucking the whole time. And when they close their lips, it sucks their sinuses. Oh my God. But
so
never mind the fact that the gross debridement is offensive at best. It's also they're upset because they wanted a cleaning and they got a cleaning. A gross debridement is a type of cleaning. It's a cleaning to aid in diagnosis. So it's still, if they have a date that night and they got a gross debridement, they look better. It didn't take away all the disease, but it's a step in the right direction. So it's the travesty is that so you're not going to give me a cleaning? Well, you're not going to get a cleaning as a prophylaxis, and you're getting a gross debridement. Why go through this? Why go through this?
Then you're right. Like, some people die on this hill, right?
Yeah, it's like you go to Chick-fil-A. Can I get the 4-piece nugget box? No, but you can get a box with 4-piece nuggets in it.
I think, I made a faux pas just for everyone in full transparency. We've already done this podcast one time and I forgot to hit record, but things are always better the
Thank
second
God I
time.
didn't do that, Peter.
Yeah, I
Because
would have
you would have gone
scorched you.
freaking
I would have dog
crazy.
cussed you up and down on
Yeah.
a podcast, but it's okay if I do it.
Yeah, it's fine.
But what I was saying,
Peter
Craig,
does no wrong.
is that, now I damn lost my train of thought because I was thinking about literally scorching. But I really did forget. Anyway, we'll get into the whole meat of the podcast.
Yep.
So I posted this, like I said, a Mighty Network, and I'm going to kind of go through some of the comments because I think this is good fodder for kind of talking about some of the suggestions, right? If you crowdsource the question and you put it back in, and I think there was some good feedback. So Anthony Gonzalez actually posts, and he says kind of eliminate the quote "you need," and he said it's a hard habit to break. I tell people about their condition, whether it's perio or cracked teeth or a ridge, and then I say the solution, right? Yep. And then and what we were talking about earlier, Greg, was basically if on the last time I hit record was that people continue to kind of verbally vomit, right? They don't let there be pauses. The doctor just comes in, does a little monologue and leaves, right?
Yeah.
So try to do a problem. Here's what I'm seeing. Here's how we would fix it. And then just wait for a follow-up question from them. Right.
I add one thing to that, Peter. So
Okay.
I say, what's the current condition? What's likely to happen over time? The prognostication of the condition, and then the solution. And sometimes not even the solution, because things that are really easy, you got decay. If you don't fix it, I've seen these types of cavities go from where they are now to root canal or extraction really quickly. And then I've seen other people that, they come back 6 months and it hasn't really changed very much, but I just don't know where you're going to be. I don't have a crystal ball.
I like this actually, because the more you say you need, it's you being judge and jury and dictator, right? And it's just like, look, my job here is not to tell you what you should and shouldn't do. My job is to my training dictates that I show you what I see is faulty, what's going to cause a problem in the future,
and educate you. You're paying.
Correct.
Sorry, dentist, you're paying the dentist for advice. And that's why I get so upset with medical providers. Like, I've gone to medical doctors before. I'm like, listen, I'm 51 years old. There's nothing wrong that I know about, but I want to know, is there some test or something I can do to give me a better intel on my health? To which most doctors are like, you're not sick, get out of here.
Yeah.
And
right.
That's not what we're looking for. Dentistry is not about getting you oftentimes just unsick. It's talking about optimal wellness. So let's say you have no cavities, you have no periodontal disease, but you're 35 years old and your incisal edges on your lower teeth have worn 2 millimeters off because you have a deep bite or an exaggerated curvus B. If you don't have that conversation with that 30-something-year-old when they're my age, they need a freaking FMR. And I'd be mad at all the dentists I saw. And by the way, I have a good anecdotal experience on this because I meet patients every day. I do an iTero scan. I look at their weather map, the occlusal scheme, and I'll rotate the lower arch so they can see it. And I see the thickened buccolingual edges of the anterior incisors, meaning teeth are pyramid shaped. They've worn off the top 3 millimeters. Now they're like 2 millimeters wide buccolingually. I tell them, hey, you're 28, that's a problem. Or 38, that's a problem. To which an overwhelming percentage say, no one has ever told me this before. So we're sucking as dentists from telling them about occlusal disease. It's not just the absence of cavities and perio.
But Craig, this is a hard thing, right? So and we've talked about this ad nauseum. I feel like, it's being able to diagnose is one thing, but being able to communicate that in a language that the patient understands, that's not in almost in a disarming, hopeful way is the next level of good to great kind of thing.
All I'm saying, Peter, and we're not going through the tech right now. This little rant that I'm going on is not about the communication style. It's incumbent upon you as a dentist to tell them what's going on. That's it. And even if you preface it that way, like, hey, I'm noticing something here that I'm concerned about. Sheila, the hygienist, brought it up. I just want to talk to you about this. Where? Well, what I do about it? Well, there's a lot of different things you could do about it. Minor thing would be wear a night guard. Number 2, you could move your teeth. Number 3, you could rebuild them. But I just need to talk to you about it. And I think that professionals are being dumbed down. Medicine is going telemedicine. The art of diagnosis is going away. Everything's being processed and if this, then this. Like when you go into the hospital, it's like they just run a series of tests, because if this test comes out positive and that one comes out negative, you must do these 2 other things.
Right.
In dentistry, by and large, we still have freedom to communicate properly with our patients. And I'm just shocked at the lack of guidance that most professionals give us. Like, yeah, you might want to consider new brakes. Well, why? I don't know, because they're kind of wearing. Versus like, hey, if you got in an accident with the brakes that you're in and you slammed on them, you've lost 70% of your braking power right now.
Yep.
Are you okay with that? Some people are like, yeah, that's kind of cool. I live in a rural community, but if I live in where I live, I don't want to lose 70% of my brakes. Thanks for telling me that.
Yeah. What do we need to do to fix it? Right.
But if you could show me if there was like a brakeometer, I would buy new brakes.
Oh, there is. It's wear on the brake pad. But anyway,
Right.
I
think that was you just alphaed me.
I didn't alpha you.
Yeah,
I didn't alpha you at all.
Yeah, that's car analogy. It's like, honey, it's called the brake indicator.
Craig, have you ever changed your own oil in a car?
Own oil? No, sir. I've changed the oil in a bike, a motorcycle.
Okay.
Okay, keep going.
Okay. All right. So Sharisa Wood, our Sharisa of Bulletproof Hygiene, chimed in and said, instead of saying this won't hurt, try, we're going to keep you really comfortable during this, right? And that is good, because this won't hurt, although it has great intentions. The patient focuses on the word hurt, right? Yeah. So next one, I chime back in because I'm having fun with this. I'm chiming into my own thread now. Scaling and root planing, right? Craig, and the patient says, well, that doesn't, Ms. Jones, you're going to have a scaling
of my teeth in the bone.
Or we're going to SRP you. We're going to need to do some SRP, Mrs. Jones. What's that? It's scaling and root planing. Well, neither one of one sounds confusing and one sounds like it hurts like hell. Yeah, neither one sounds like a good option. So a very viable thing might be to talk. And when I say talk, obviously you're talking in front of the patient and talking in front of the hygienist. Might be a deep quadrant scaling.
Oh, no, we do NSPT, non-surgical periodontal therapy, in my office. NSPT.
That's what you say?
Non-surgical periodontal therapy. Yeah.
Yeah, that's a little clunky too.
It just sounds better. It's non-surgical. I like that.
That's true. Everyone, who doesn't like a non-surgical?
Yeah. We can do SPT, surgical periodontal therapy. You can have it your way.
So Jason, Tessor, Craig, help me with that. His last name. Why am I? Tesoriero?
Tesoriero.
Okay, good. See, I didn't have the tongue. I didn't have the tongue roll.
I know. I don't know if it belongs in there. Jason, hit us up.
Instead of saying, sorry, I'm running late or running behind, instead try, thank you for your patience.
Yeah.
I think that's a great one. Right? That's a great
one.
I
mean, like, just take cues from like the nice hotels you go to. We're going to go ahead and put your credit card on file. We're going to go ahead and take care of your balance today. Oh, you're going to do that for me? How nice.
Yeah, thank you for doing that.
Thank you. We're going to go ahead and take care of your balance. It's okay if I put on the card right at the get.
So Frank chimes in with Frank Michiti. Michiti chimes in with, instead of periodontal disease, try gum infection, right? Yeah. And I actually really like that because everyone, especially for, COVID infection, everyone knows infections need to be cured. Infections need to be addressed. Infections need to be treated. Versus periodontal disease seems like, I don't know what that is. Is that something we can do? So I like the gum infection aspect.
Yeah. Plus, people are very attuned to when you have an infection, wanting to fix it immediately. So you have an infection. What do I do?
Yep. And then Kerry Brown is our next one. He says, "Think this is a great topic. For extractions, I say I want to make sure you're comfortable the whole time. So raise your left hand if you feel anything aside from a little pressure, just need a break. Instead of if you feel anything sharp or painful, right?
Yeah. Got it.
Which is going to put them on alert even prior to the meaning. If you say the latter of what Carrie is saying, then it's going to be they're already getting ready for something to hurt, right? Let's see, gold. Okay, Angela.
I love the yet.
Yes. So we say things like, "Is anything bothering you?" Instead of something is saying anything bother you, because people are inclined to be like, "Nope, looks good. Everything's fine." Like you were saying earlier, Craig. People just kind of want to get in and get out. Or say, "Does this hurt?" Instead, say, "Does this hurt you yet?"
Yeah. Are you feeling this yet?
Yeah. Well, what
No,
do you
not,
mean
and
yet?
they always say the same thing. Not yet, but when? I'm like, I don't have a crystal ball. I
That's
also like when you move forward with treatment versus if.
uh-huh.
That's
Uh-huh.
important too. Like that's just a little bit more sales coaching.
Um, and then let's see. So let's see. Craig, can you help me with this last one?
Yeah. So
I can see it on my
VJ, I
screen.
think VJ's in Australia. She's been commenting for a long time. That's kind of
Yeah.
cool. So go ahead and read that in an Australian accent if you don't mind, Pete.
For treatment plan recommendations, I would say this would be best. How's that, Craig?
That was pretty good. I like it. So
Nice.
rather than this is what I recommend, yeah, I think it's great. And she uses the termite analogy for untreated caries. Yeah, I love that. And
This
I
is
know,
what would be best rather than this is what I recommend. I do like that. I do like that. I use the termite analogy for untreated caries, meaning also to give patients that's also to remember to give the patient room to speak, like we were kind of alluding to earlier. Like
yeah,
give a little pause, give them. It's not a monologue, right? It's a conversation.
I
Um,
want to put something as a placeholder right now because what we're talking about is often considered to be a taboo subject because we're using the words like how to sell, right?
mhm,
So the US government probably spends, I don't know, tens of millions of dollars, maybe more, on getting us to just click our seatbelts in or stopping smoking or just trying to live better, less diseased lives, less morbid lives. And what we're doing here is we're trying to figure out how to, because unfortunately, teeth don't always have the symptoms present to what's actually going on. When you have an arthritic change in your joints, you feel it, you seek care. Teeth happen to have something where by the time you feel it, you're up the creek. It's too late. If you come with a toothache, you're not getting an occlusal filling with a
right.
toothache. So there's a disconnect between understanding and the problem that's a problem in dentistry, and we need to talk about it. So we do need to develop really refined ways to describe and enroll things, because if patients do the preventative treatment that we recommend, they're going to spend less money and have less care. I do not want an FMR. Neither do you, Peter. None of us
Right.
want FMRs. But if we're not comfortable talking about the incipient forms of disease and then we kick it down the road, we're going to have a bunch of 55 and 65-year-old people needing massive dentistry because we were just afraid to enroll them, or we thought, I don't feel comfortable selling.
And then guess what happens? Then it's super sweaty back, because if you've got a
Right.
patient for 15, 20 years, doc, I've been coming to you for 10 years. Why didn't you say something earlier?
Why didn't you?
Right. And then
And
it's a
then you,
super sweaty back. So
right,
almost, and then you as a clinician almost anticipate that. And it's like, well, what if they challenge me? So then guess what you do? You don't say anything at all, ever,
right,
because yeah.
right. You get
So
one review. Oh, I went to Dr. Boulden and he recommended I needed all his work done. I went to some other guy and he
he
said they need
recommended
nothing.
nothing.
Because what is age inappropriate wear? You can take a girl, that's 25 years old with perfect bite, perfect occlusion. She's worn her teeth down to like what a 60-year-old should be, but she's got no cavities and no periodontal disease. So you say, hey, we need at minimum a night guard, or at maximum, you need to rebuild your posterior and your guidance and blah, blah, blah. And then they go to the other schlepper down the road, be like, whoa, he tried to tell you need 50,000. No, you need nothing. You're fine.
Oh,
Your
that
teeth are
Dr.
perfect.
Spodak, he's trying to pay for his
Yeah.
boat. He's trying to pay for his boat.
But that's so disheartening, because we
Right.
just need to get on the same page. And I think this is an important topic to just elaborate on, that if you don't have the training, don't disparage the other person. I think we do such a disservice. I think the greatest force against dentistry is not the corporate DSO, blah, blah, blah. It's other dentists shit talking each other, without a doubt. I see
You
too
know,
much of it,
you know
too
what
much
you know
critique.
what the dental firing squad is, Craig?
Yeah, you all stand in a circle.
Yeah, it's a circle.
Yeah.
Hmm.
It sucks
It
because,
does suck.
it's, I mean, there is overtreatment, there are overzealous dentists, but, there's a lot of 55-year-old dentists going through level 1 of Cois and Spear. And you know why? Because they probably just practiced a certain way their whole career, and they had those sweaty backs where they saw little Gina and she was 18 years old and told her not to worry at 25 and 35, and now she's 40 and she has a collapsed VDO and her teeth are worn to shit. They look at their old photos and be like, damn, I gotta go learn occlusion. at that point at 55. Well, kudos to them, because some people will practice their entire lives and never learn occlusion, never do an FMR.
I think the takeaway with this one, Greg, is, I'm big on saying the word audit. Audit
Always.
your patient experience. Also, audit the way your reception area looks. Audit the way, the clinical flow. Audit the way your phone is answered. Audit means just continue to review.
But all of your language.
So in this context, yes. When you're not doing something, go eavesdrop on your hygienist. Go eavesdrop on some of the assistants in your office, right? And if you've kind of mastered the art of verbiage, or you've also mastered the art of being empathetic towards patients in clinical presentation, if you will, then it's your job as a leader to then teach that, right? And that's a whole, then kind of teaching it into your hygienist or your assistant or your business manager or business team that answers the desk. That's a whole art itself. Like, not that way, stupid. You can't do that.
Oh,
yeah. You have to
been there, done
like,
that.
hey, right. You have to say, that was good. That was good. Next time, what I'd say instead is something like this. So you kind of sandwich it. And there's a whole art in correcting people and leading people and training people.
And what you're really talking about, by the way, is a global consciousness to audit yourself. Self-awareness, just because you're saying it and it's not working, just because the way you're leading your team and you're really, when you catch them doing something wrong, you beat the crap out of them. I've been there, I've done that. Or the way you're speaking to your kids. Language is the most powerful tool because it's your subvocal thought. It's the way you think. So if you start listening to the way you speak to patients and you're aware of saying the word bone or gross debridement, you become globally aware of how you're speaking. And by the way, there's something that, like, when you talk about fixed and growth mindsets, people that are growth mindset use the word yet a lot. Right. I don't know how to play tennis yet. Versus like, oh, I suck at tennis. No, you haven't had lessons or whatever. So I think that if you can just start turning your focus on the way you speak and and your words you use globally, you're going to live a better life because you're going to audit it and change it. Things that are not working, you'll get better.
Even recording yourself, right? Not for the context of like a patient conversation and, oh, I have this documented, but like video record, put an iPhone up when you're about to have a conversation with someone, and then record it. Because lots of times you can go back and watch that and be like, oh, I said that, I should have said this. And you won't remember the lesson in there, right? But it's just repetitions. It's just practice like anything else, right? The more reps you do.
Yeah, it's a new muscle.
Progress isn't perfection, but I'm sorry, perfection. It's progress, not perfection is where I'm trying to go, right?
Right. And by the way, progress is what makes people happiest. Just going forward, even if you're crawling forward, getting a little better every day. And I've been really lucky. I've been surrounded by great practitioners over my career, and I'd listen to them like, wow, that's really good. So simple. And also just being confident in what you do. I've had doctors that do it all wrong, by the way. I've had the doctors like, we're going to drill your bone and blah, 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 blah. But they're so confident and they're so excited about what they're going to do. I feel like, I don't know what you just said, buddy, but I like you and I'm going for it. So it's like that swagger too. You can say it all wrong. Yep. But for us mere mortals, we need to watch our language. We do.
Yeah. And guess what? Vicariously, when you start upping your game without even saying something, the team will hear you start to say that over and over and over again. So instead of, when you would have said scaling and root planing, now you're saying gum infection, right? Deep gum, something like that. All of a sudden now the vernacular changes in the office, it does. Right? And because it's a top down, like everyone is looking to you potentially to lead, right? When you have a bad day, the office knows it, right? The office potentially could have a bad day too, because you're usually the tip of the spear if you're listening to this pod.
And by the way, so you know how someone commented on Mighty Network about giving the patient the space to understand and process. Same thing with your leadership skill. When you're a person, potentially like me, who likes to be the center of attention, talks a lot, I can suck the oxygen out of the room, and that affects leadership too. So these lessons that we're talking about for patient language are really just for communication in general. It's important for people to trip over their own truths, for people to recognize the mistakes they made and not have you, hold it against them. The idea that patients have choices, and, when they say, well, you telling me I have to do this? No, you don't have to do it. You can just leave it. It's an incipient process. It took you 20 years to get this way, and you know, you can kick this can down the road. It's just my obligation, it's my duty as your dentist today to tell you everything I know, because when they know what we know, they make better decisions. If your roofer tells you that, like the brake pad analogy, you know, was that this podcast or the one we didn't record from before? The
I
brake
don't remember
pads.
now, but you can go ahead and you can
Yeah,
say
but
it
it's
again.
like, oh
I
God,
think it was
imagine
this
if we
podcast.
imagine you just want me to like step into this one. But imagine if you could know that. So it's like the doctor. When I go to my doctor, I'm finally, you know, going to take a page out of Peter Boulden's book and be like really proactive with my health. Because Peter's not reactive. Peter's like, if there's something that I can do, thank God I've got the money and resources. If there's a $500 test or a $2,000 test that's going to show me something, let me have it. And I went to my doctor and I'm like, you know, I'm not worried about money. You know, is there anything you can do to tell me to be at the next level of my healthcare? And he's like, nothing. And then I talked to my friends, and there's cardiac calcium scores and CT scans and that cancer thing you did.
And Frank's son.
And Frank's son, you jackass. So put a pin in that. Peter and I both have creases in our ear. We'll leave it at that. Peter, literally on the night of our of our summit, we were sitting in the suite, like preparing for the next day. He's like, bro, this might be the last time I see you. And got really under my skin. He's like, you know, with that Frank sign, that crease in your ear, you may not be around that long.
You might have a heart attack right there.
Right now.
Right on the stage.
He's like, look around. Do you see an AED? I don't.
And yours is so deep. I don't know. I mean, Craig, I love you, but this might be your last summit. So you proceeded to go around and tell everyone, like, look what he did to me. Look what he said to me right before.
It's like right when we went up on stage, KK was on stage, and KK obviously works with Tony Robbins. She's a total badass. And he's like, as soon as she introed us, 20-minute intro, he's like, dude, this is all on you, buddy. I would not want to be going up after KK. This is going to be very hard.
That's what friends are for.
So let's get back to language.
Hey, well, wait.
Destructive languages of friends.
Language is everything, like you're saying. And, you know, and that's why I think even we talk about body language so much, right? Because yes, language is huge, but a lot of things are nonverbal as well. So that's a whole different topic. We've had that conversation. An excellent podcast is the Chris Ramsey one we did a couple of years ago. But Craig, this is the verbiage is such an important thing that I think we both believe, our offices both believe, our doctors all believe, you know, that it was important enough for us to actually put it in the field manual. So I think we have in our field manual, I think we had that we give out at the summit, a couple pages of these examples of like, instead of this, try this.
Yep.
And look, these are little micro shifts. So you're listening to this podcast and you're like, that's, you know, whatever. You're talking about words, like not important. But it's little tiny shifts, right? Everyone's always looking for the big lever. Give me the marketing hack, like Craig says, right? What's this Yelp hack that's going to take me from 1 million to 2 million? There isn't one. What it is, it's a series of 100 little tiny levers like this.
Yep.
Right? So this may be one of 100 things that you start implementing that all of a sudden now your practice is going gangbusters. And you're like, what did we change? We don't really know. But it's this 1% betterment every day. 1%, 1%, 1%.
Well, I think to the, you know, Patrick Bet-David always says the worst types of people who are hungry and lazy. People that want more, but they don't want to put the work in. Those are your haters. Those are your friends that you had to leave behind. Those are the people that are most dangerous for you, because they'll look at you, the person that's listening to the podcast. Because if you're listening to the podcast, you're already in a segment of the population of like, I don't know it all. I want to learn. I want to get better. So we're already talking to an overachiever. But what you have to recognize is no failure is final and grandiose. It's a series of small failures, and no success is final and grandiose. You know, you might get a break, but you just work every day. And listening to a freaking podcast, you're choosing to get better. You could turn this crap off and go listen to Cardi B, you know, right now, but you're not. So it's I like that little that you're in control, and we're talking about growth mindset and learning better techniques.
Can you hear this coming through?
No, is there some?
It's Patrick Bet-David, right? And so it's a example that prompted this podcast to happen, and it was it's 10 persuasive words that millionaires use to get things done. And so this was actually, now that I remember, this is what prompted me to post it on Mighty Network. So I was listening to, you know, Patrick Bet-David's things that he was saying. Look, verbiage is so big. so big that, and these are things that you want to use in business. And I was like, golly, there's 10, but there's probably 20 or 30 in dentistry. Right. So I'm going to put this back to the screen, Craig, because he's saying just communicating with people. Let me share the screen again. Good. Okay. And these are things like, what he's saying is to say things like, hey, can I request this of you, as opposed to being like, I need you to do this, right? I'd like to make a request. Asking, may I? Let's process this together. Let me get back to you. If you don't know the answer to something, you can say, hey, let me get back to you, and I'll get back to you, right? As opposed to kind of just sitting there and being like, well, the answer is. So many things, I think, Greg,
So
are
some of these
derived.
things, though, may I suggest, and let's process. This is vulnerability. This is
Right.
like, you think you're the boss of the practice. You just acquired a new practice. The old guy left or the old gal left. And now you're running the show. And we think as leaders, we have to have all the answers. And what this is, request, suggestion, may I, you're giving people space. And what most organizations need is not to whip them into shape, like you hear all the time. Like, I took over this practice, I need to whip everybody into shape. I got to whip, I got to get things back in order. It's not that. You're actually whipping them too hard. So it's like suggestion, may I, let's process this together. Those are palliative words that allow people to come out of their shell. You're getting people to contribute. And that's what PBD does really well. And I was lucky enough, when he's in the chair, he'll talk about, like, I don't know if I ever told you the story, but he said something like, I'll make up a name. He's like, hey, let me ask you something, Johnny. Ben, because we're working on Ben's problem. He's like, does Ben have a good relationship with his father? And Johnny's like, no. Ben's the guy that, his father left him when he was 4 years old. He's like, yeah. Okay, good. And then he moves on to the next thing. I'm like, well, Patrick, do you lead people differently if they have a good relationship with their father or not? He's like, I lead everyone differently. So he's that level.
Wow.
So, like, do you know, Peter? I mean, I'll admit, I don't know for everybody, but do you know consciously in your organization which doctors have good relationships and bad relationships with their father?
No.
So I had to figure that out the hard way. And I led somebody like I like to be led and like you like to be led. Peter and I just don't fluff anything. Give me the real shit. What can I do better? Did I fuck it up? Tell me straight. Yeah, Craig, you fucked it up. Good. Move on. You and I have good relationships with our fathers. Good men, solid guys. We've been, I don't know. I don't want to get too woo-woo because you're going to fucking hang up on me right now. But when you have a person that has a fragile self-construct, you actually need to step into the father they never had if you're willing to be that level of leader. And PBD is that level of leader, obviously. It's just
next level.
He's next level, but that's why he gets next level results.
All right, let's wrap.
Good segue.
Well, look, it's important, and I think we're drawing business examples, right? Because as much as we think that dentistry lives in a silo, and there's lots of sales, there's lots of business communication, there's lots of leadership. I mean, it's all the same things taken from different industries. It's the same thing. It's still a business at the end of the day. Yep. So I think opening your mindset to listening to people like PDB or Tony Robbins or whatever it may be, right? It only augments the things that you can learn, and then you can audit it based in the environment you're in.
But one thing I just want to add to, Peter, is as you get on in life, like we are, and we have more experience in the larger network, you start to see these people with exceptional results put an exceptional work in. Mm-hmm. So I used to really, as a younger guy, think like, oh, that guy got lucky, he probably doesn't work that hard. All the people like the PBDs of the world, or the Tonys, I get to see them in their private time, and it's like, damn, I don't want to do that. I don't want to, right. I can't do what Tony does. I can't do even like what an APA does. APA's flying all around the world, bro. I don't want to do that. I don't want to do that. So
did you see one of his, and I'm going to give you, I proclaim that I'm never on social media. And then I actually saw a post that he did recently, and someone's like interviewing him about like, I need to send it to you. It's basically about like, what next? And he's kind of like, ideally it's to train my next generation and me kind of tap out, essentially. I was floored because he's usually been this like,
if that's what he wants to do, everything's got to change because it's right. His social media is the him show.
That's what the interviewer said on this social media was like, well, everyone's coming for APA. He's like, no, they think they're coming for me. What they're coming for is a different level of experience. They've got it
That's
confused.
aspirational, and I think that would be great if he could pull that off. But if it's fine. It is what it is. The point I was bringing him up is he's doing things that I'm not willing to do. I just don't
Right.
want it.
I know, but I
Or
wanted
I don't want PBD's life, and I don't want Tony's life. It's magical, and there's great things, but these guys are born to run, and they run.
and it takes great sacrifice, probably.
Oof. But they're called to it. I mean, a good business can be almost like a spiritual endeavor. I mean, if PBD is leading his people where he's saying, does that guy have a good father or not? He's not just doing business. He's doing leadership. He's doing personal development. He's making people better. And that's a great calling. It's a great calling to do that.
Mm-hmm.
When I was telling him I said something about my son in baseball. He's like, I want to write this down. So when Gavin wanted to quit baseball, by the way,
Mm-hmm.
he was like little league, I don't know, 6, 7 years old. He's like, Daddy, I just don't like it. I'm not good. I'm like, okay, no problem. We'll quit. No worries. Just do me a favor before you leave. Go in the dugout and tell everybody you're quitting, just because I don't want to be the one that tells them. So he walks over. He's like, okay. He walks over, and I didn't follow him, but I saw him walk up to the first one, and then he said some things to the other one. He comes walking back. I'm like, well, what happened? He's like, I can't quit. And PBD's like, I'm going to write that down. And it's just like that. That's if we're doing our jobs well, we can elevate our team to that type of level. And it's fun to be the smartest person in the room. We get a lot of our ego stroked by being the leader, the boss, and telling everybody what to do. But in actuality, when you unlock people's autonomy, and making them make the hard decisions, you make people feel better. They work harder. You don't have to be there as much, and everybody's happier. So I think that's and that's all language too. So I'm really trying to pull it all the way back home. These are language. When you say we're gonna do everything we can do to make you comfortable, it's also when you're leading your team. What should I do, boss?
Totally.
What do you think you should do? Well, I don't know. That's why I'm asking you. What do you think I would do? You'd probably do this. That sounds good. Why don't you try it? What if it doesn't work? I don't know.
It's so hard. I mean, this is hard. This isn't reading one book and then it's mastery. And I am by no means a master at things like that, but I'm a student of it, kind of like you, Greg. I think you're more of a mastery level just because you have really high EQ and kind of how to you read people, and you're able to say kind of things curated to who they are. Essentially, you pick up on that. But I think just mastering the art of this communication is something that'll make you a better person, nonetheless, dentist, right? But it's never ending. Just when you think you're good, you're like, golly, I sucked at that, and you're like, geez,
man. I know. That's the thing
then,
about being a human, and that's why you have to have so much grace for yourself. Because as Naval, or I think it was Joe Rogan or Naval, they said, don't give yourself too much credit. You're just an ape with a plan. You have a limbic system that you and I can have this rational conversation right now. In an hour, someone's going to cut us off on the way home from work. We're going to spill our coffee. Your wife's going to call and scream at you. And now you're a freaking raging ape. And you're like, what just happened? I had this evolved conversation. So you have to understand that we're an emotional creature, and we will never master it. There will always be a new situation that God or whatever the universe will put in your life to make you unzip. And you'll be like, what the hell was that? And I think the best hope for any of us is that we can dust ourselves off quicker than the last time, rather than go through a 7-day tirade of feeling like shit. You can go through a 7-second, like, hey, can I get a do-over? Whoa, wait. I don't like what I just said. I'm really sorry I said that. I'm just upset my dog's sick or whatever. I'm really sorry can I get a do-over? What I meant to say was blah, 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 blah. And people respect that shit.
They respect that for sure.
Even with a patient, by the way. So just
say,
hey,
a lot of pride to be able to say that, though. Sometimes,
but you'll have a better life.
I agree.
You'll have a better life.
All right, let's wrap on that. We're going down rabbit holes.
Well, you haven't had me on in a while, so these are the rabbit holes that we
you've just been vacationing all around the planet. It feels like, So extended Aspen. Do you think you could be a mountain man, by the way, since you've been in the Rockies for a month?
Aspen's a weird type of Rocky Mountain man. It's not the Rocky Mountain man that you're thinking of. It has nothing to do with the Marlboro man.
Right.
Think of like Zoolander with a cowboy hat, basically, and on cloud shoes and a Hermes belt. So picture a guy with jeans, an Hermes belt, on clouds, and a Kimosabi cowboy hat that's like $1,400 or $2,800.
And that's Aspen.
That's Aspen, brother. But it was cool. I love it. Not complaining.
You glad to be back to the beach?
Yeah. Yesterday I packed up and went out to the ranch and got some stuff done, and good to be back.
I always say that, one of the things in life, if you're kind of winning at it, if you go to an extravagant vacation, right, whether it's in a beautiful place like Turks or Bahamas or Europe or something, and you're glad to be home,
Yeah.
right? And you can't wait to get home because you won. You kind of won. You're winning at life, so to speak. When you desire to be home and back to your routine, it means that's where you're happy there, right?
Yeah.
So this perpetual vacation that people think that they want, I want to just travel the world. I want to sit on the beach with Corona or whatever it is, right? Like a lot of times, the grass is greenest where you are. You just need to water it more.
Yeah, that's true. 100%. So true.
But travel, I think, Greg, travel makes you appreciate that, right? You appreciate your home more, surprisingly, than when you travel. Not that you're having bad experiences, but look, you were probably hyped to get home. Granted, you've been gone for a long time, but like you have more appreciation for your environment now because you have the context of other places.
Yeah, I just think that I think the monotony of doing one thing or being having to do something. I think it's, there's this idea that if you could work not because you have to, because you want to,
totally.
That's a great thing. Like the drudgery of being forced to do something. It's like when you had to read Moby Dick. Moby Dick's a great book, by the way. It's just you and I had to read it when we were like 13 years old. It was freaking drudgery. Although, so if you can just get your business, if you can either get your life, your practice life, so that you can balance your burn and your earning number, or or create a business that can function without you, it's really nice then to work, because that's beautiful.
I agree. Well, I can say that everyone's glad to have you back, Craig.
Thank you.
I had to try and curate solo anymore.
I listened to all the podcasts.
Lost a lot of subscribers there, pal.
I loved them. I loved them all. I bet you we're gonna get a couple comments of like, I liked it better with just the Pete.
I don't know. I've never heard that sentiment, but I
don't know. I might make a fictitious
but if
Google account.
If it does happen, I might frame it and put it behind me in perpetuity, just so you can sit there and stare at it.
Yeah, I appreciate that you do that for me. Good stuff. Pete. Anything else going on in your world?
Nope. Just building 3 offices in the next 6 months, but that's about it.
No joke, brother. No joke. Yeah. I'm expanding.
It's fun, dude. That's where I thrive. That's where
I know you do. You're a creative guy.
I get lit up, and it's just a series of events, building a headquarters and call centers, and changing locations and building.
My boys growing up.
The what'd you say?
My boys growing up.
Yeah. So, but it's fun, right? It's. I feel like I've plateaued, or the practice, but like our practice has plateaued for a couple of years, and it's time to make next level moves, regardless of where the economy is, regardless of where the interest rates are. We're charging forward because why the hell not, Greg?
Yeah, you're either growing or dying.
Why not me? Why not me?
You always say that you're either growing or dying. There's no such thing as coasting.
Yeah, contracting or expanding.
Peter Boulden.
That's a Peter Boulden-ism. There's not many of them, but all right, brother. Well, I'm glad to have you back.
Likewise, buddy. Good to be back.
Everyone,
and thanks to all the listeners. If you like this content, please hit the like and subscribe button. Because
we're doing that now on YouTube, huh? Right? Because we're now YouTubers.
Are we really? Well, I met a YouTuber out in Aspen.
Well, you met a YouTuber?
Yeah, I did. Yeah.
Dude, my son was asked what he wants to do the other day, and he was like, I think he said, I believe maybe this was 3 or 4 months ago, but he was like, I want to be a YouTuber. And I was like, what'd you just say?
That's awesome.
It's terrible.
Wow, why not? My son wants to be a dentist.
Well, that's because he's got 4th generation. It's easy. He'll step into a giant practice.
Well, whatever. I told the guys here, if I get hit by a truck, you guys got to break his balls. I literally said that. I said that he can get fired for being late. No nepotism here, buddy.
I love it.
Good to see you. Good to be on this. I love this new, beautiful. What do we call this?
It's just a template. It's a YouTube template that
doesn't feel fitting of what it is. You can't say it's just a template for those who are listening to us. Go on YouTube. This is a masterpiece.
Hours of Peter's work. This is
hours. Greg just steps right in and be like, hey, this is cool. Let's roll.
Yeah, I've been gone for a month. What's going on over here?
I should go away more often. All right, Peter. Good to see you. Good to listen. Good to talk to all y'all. And we'll see you soon.
Over and out.
Over and out.